All right, hey folks, today we're going to finish up talking about these disorders that are related to anxiety. So again, in the DSM-4, we saw that these disorders are put together under one umbrella of anxiety disorders, but here in the DSM-5, they've split that one category for the most part into these three separate categories. Again, they do hold together in the sense that they all have to do with anxiety or often have anxiety as a symptom or a likely symptom of the disorder, but they've gone ahead and separated these other disorders which they feel aren't centered as much around anxiety versus more just having anxiety as a possible, if not a predominant symptom of these other two types of disorders. So, of course, you can see up here that the two other types of disorders that we're talking about are obsessive-compulsive disorders and trauma and stressor-related disorders. We'll get into both of them, but I do want to start with the obsessive-compulsive disorders. If you haven't seen, by the way, I have added into the playlist for this class a few videos that go along with this set of lectures. That is to say, the anxiety disorders to some extent, but more so to do with these trauma and obsessive-compulsive related disorders. So if you haven't had a chance, I would suggest you go ahead and watch those videos before you watch this lecture, just because I'll probably be referencing the videos as I go along. So just so you know what I'm talking about. You don't have to. You can watch them after if you want, or you can watch it in the middle and watch this twice if you so feel like. The other piece I would say is that when you're watching that video on, in particular, reactive attachment disorder, just be aware that there are some sort of intense themes to do with that video. So just if that type of thing might bother you, it has to do with abuse and this type of thing. If that type of thing bothers you, just take care of yourself. I would like for you to try to get that information if possible, but I know I've had students in the past that have had trouble with that type of thing, so just making some room for that. Also with that reactive attachment video, it is the longest video of the three that I've posted related to these lectures. You don't have to watch the whole thing. Often I show those videos in class, and I do watch the whole of the other two videos that you see there, but I usually just kind of give you 5 minutes of the reactive attachment video just to get a sense of what that little girl is like. So again, if you haven't watched those, I would suggest go ahead and watching them. If you have watched them, then sorry to waste your time here. Let's jump right in. So what I want to do is go through these obsessive compulsive and trauma related disorders. In some cases, I'll just describe them to you, and then in other cases, I will reference the DSM and let you look, or at least read to you, the actual symptoms and diagnostic criteria. But for others of them, I'm going to trust you to do that, and so we don't spend too much time here in the video talking about it. But it is important, of course, to think about how this looks on a person, and to think about how a psychologist, a psychiatrist, or a counselor would go about diagnosing a disorder if somebody like this were to come into their office seeking help. So let's start out with obsessive-compulsive disorder. First thing to understand about this disorder is that it does have these two components. And in general, all of the disorders that are in this category are going to have usually both, but sometimes maybe just one or the other of the obsessions or the compulsions. So what's an obsession? Well, an obsession is something that you simply can't stop thinking about. This is what we mean when we say it clinically, and this is pretty much what we mean when we say it casually, right? You're obsessed with this thing, you're obsessed with that person. Usually that means you can't get that thing off your mind, right? It's just something that keeps recurring. In the case of a clinical obsession, what we're thinking about is usually something that's anxiety provoking or fear inducing or perhaps even depressing or something like that. But again, usually these disorders are going to tend towards anxiety. And we've talked about how anxiety tends to be future directed, where depression tends to be past directed. So usually, not all the time, but usually we're going to see that these obsessions are looking into the future. That is, what if, or worry, or what if not, right? These types of things. And so the obsession is often something that the person can't get off their mind. And so this might be something like a very simple one that we've probably all heard is, if I step on a crack, I will break my mother's back, right? Here's a real simple obsessive compulsive feature that many of us have probably played around with, if not worried about, when we were a kid, because we thought maybe this was true. But that idea of you walking around and seeing cracks everywhere, right? Especially, you can't see it here, but in this classroom, right, the floor's tiled and the seams between the tiles are technically cracks, right? Here I am obsessing over it already. So that idea of everywhere I look, there are cracks, and I have to be really, really careful about where I'm going to walk and where I'm going to put my feet, right? That's the obsession. It isn't necessarily, as we think of obsessions in a more kind of casual context, it isn't necessarily that obsession is removed from the environment or is out of context. Often the obsession in an obsessive compulsive disorder is going to be contextual, is going to be contextualized. That is to say, it's not necessarily the thing, and it can be, and I'll give you some examples. It's not necessarily the type of thing where you're just thinking of it out of the blue, right? You're asleep in bed and, oh my God, did I slip on some cracks today? That might be a piece of it, but you're more likely to experience that obsession when you're actually out in the world and you see cracks on the ground, right? So this obsession, when we think about it casually, again, is usually something, oh, I'm sleeping in bed and I'm thinking about this dream car that I want. Man, I saw it again today. It was so beautiful, right? And that's kind of the obsession that you bring into your head. It's not necessarily related to anything that's going on immediately. And that's what we mean when we say that type of obsession. That's really more of a rumination, if you want the actual psychology word. But here, when we say obsession, this is going to be in context, right? Oh no, if I step on a crack, okay, right? And so for every step, I'm obsessing over where I put my feet and how I let them fall on the pavement or tile or whatever. So that's the obsession piece. That's the one side of obsessive compulsive disorder and obsessive compulsive disorders. Is that folks have this obsession, right? And it again is usually brought out in context, right? You see a thing and what if, right? You maybe think about people who need to wash their hands a lot. It's probably not a too bad one to have these days, but those folks maybe touch something and immediately, right, there's that context of, oh my God, my hands are disgusting. My hands are disgusting. And often the other thing that comes with it, it was inherent in that if I step on a crack and break my mother's back, is there is some consequence of not paying enough attention to the obsession, right? My hands are gross. If I don't wash them, boop, 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 a list of possible things that could go wrong, right? My hands are gonna fall off. They're gonna look gross. Nobody's gonna want to talk to me. I'm gonna get some disease. I'm gonna touch my food and I'm gonna eat that bacteria, right? All of these possible negative outcomes that come along with it. Again, future oriented, right? Goes right along with anxiety. But again, you can see where that obsession comes from, that it's going to be contextual. It's going to be something that this person is basically worried about or can't stop thinking about, these types of things. And this overzealous thought, this obsession, leads to some sense of anxiety, right? This is going to cause this. If I do these things or I don't do these things, bad things will happen, right? Bad things will happen. And so the other side of that obsessive compulsive disorder, of course, is the compulsion. And often the compulsion serves to soothe the obsession. So if I have this obsession, step on a crack, break my mother's back, well, what's the compulsion that can soothe that? Don't ever step on cracks, right? And so if I have this type of disorder, this type of obsession, well, my compulsion is gonna be, okay, I'm really, really careful about where I step and making sure, oh no, right? I'm gonna be really careful about how I put my feet down. And a compulsion is basically a behavior that you don't really have control over. Really, it means, it doesn't perfectly fit here, but really it means that something you're maybe doing over and over again out of habit, something that's compulsory, right? Something that you just have to do, but everybody has to do it, or you have to do it and you have to keep doing it, right? That's what compulsion really means, something that you're kind of just compelled to do, right? It's not your choice necessarily, but you're thrust into it, and that happens either often or it happens to everybody. So the idea of a compulsion here is a little less helpful when we think about it in a casual term, but what we mean here when we say clinically is that it's the other side of this obsession. It's the thing that you have to do because the obsession demands that you do it, right? And you can see the meaning, right? It is still somewhat out of your control in the sense of the anxiety is causing you to do it, but you're the anxiety, right? Spoiler alert. So you're kind of forcing yourself to do this thing that you don't necessarily want to do. Maybe it seems impractical, maybe you are, and here's what they're trying to mean with it, though it doesn't always look this way for all types of OCD. Maybe you're doing it over and over again, right? That's what they really are thinking about when they named it a compulsion, was something that is being repeated. So the more classic example, for instance, of I need to wash my hands, right? If you may be compulsory washing your hands every time that you touch something, every time that you enter a new room, every time that, I don't know, you leave the house. I mean, you're probably supposed to do that anyway, but the idea here is that you're kind of just doing it to do it. You're just doing it so much that it seems like a true compulsion in the casual sense, right? It seems like this thing that you're just doing over and over and over again, and you don't necessarily have control over it, even if it's maybe just a habit. And so the idea of the obsessive-compulsive disorder is that here's a person who walks around with these worries in their head, right? These kind of rules about if I don't do it this way, or if I don't do this, or sometimes they're not even rules. The obsession itself doesn't have rules. Sometimes the obsession makes the person make rules, right? Things are disgusting. Everything is covered in bacteria. Okay, what can I do about that? Well, I just need to wash my hands a lot of times, right? And so sometimes, you know, the obsession itself doesn't have the rules in it, like step on a crack, break your mother's back. Other times it'll be the person having this thing that they're really worried about and trying to make up a rule to soothe that anxiety. Well, I'll just have to keep washing my hands over and over again. Well, I'll just have to make sure I check the lock 15 times. I definitely don't want anybody breaking in my house. So I know I locked it, but like I gotta go see, because what if I didn't lock it, right? And this is the cycle, right? You get somebody who's going back to check their door 100 times. You get somebody who's maybe flipping light switches over and over again. You may be getting somebody who's checking on appliances. You probably saw something like that in a video with the guy who's got OCD, right? Where every time he bumps his basket, he's got to go up and wash it. Every time, you know, he goes to bed at night, he wants to go back and check and see if he left his stove on. Every time he comes back to work and he wants to sit in his office chair, he's got to clean it because who knows who was there before, right? These are the types of behaviors that you would expect to see with somebody who has OCD, Obsessive-Compulsive Disorder. Now, often when you hear folks talking about OCD or Obsessive-Compulsive Disorder in just an informal sense, or just talking to friends or family, or maybe you're kind of calling somebody you know OCD, usually when I'm talking about this in class, some people start raising their hands, right? I mean, I don't know, they want to identify themselves as OCD. That's fine, but often times when folks talk about OCD in those contexts, often what they're really referencing is something we're not going to get a lot into today, but I do just want to make you aware of it as a different disorder, is something that we call Obsessive-Compulsive Personality Disorder. I'm going to write here does not equal obsessive compulsive personality disorder. Okay. So the obsessive compulsive personality disorder, it is a real shame that they named him the same thing. It is really just a shame. The name is better for the actual obsessive compulsive disorder. We talked a little bit about how the compulsive goes off the rails a little bit in terms of understanding exactly what the disorder is. Not that that necessarily matters, but it's a good name for obsessive compulsive disorder. It's not really a great name for obsessive compulsive personality disorder. They share a name primarily, I think, because they, on a very, very superficial level, can look similar. Even less so than when we were talking about last week how agoraphobia and social anxiety can look similar on the surface. These are going to look even less similar on the surface. It's going to be even more of a superficial similarity. That is to say, if you looked, you could tell the difference. If you looked at an agoraphobic without asking questions, and you looked at a socially anxious person without asking questions, you would just observe that they both do not like social situations for the most part. They do not like being in public for the most part, right? And so you have to kind of dig in to get at that. But here you would observe that this person has a really strict set of rules, a really strict set of things that they are always attended to, right? Obsessive compulsive disorder folks have the things that they're doing. It isn't kind of this global obsessive compulsive behavior. They can add things to their list of rules and obsessions that they are currently dealing with, but it isn't global. It isn't, you're the person who needs to wash your hands, I'm the step on the crack person, and you're the, check the stove every night before you go to bed 10 or so times, right? I'm gonna say, dude, your stove is off. Like, what are you freaking out about, right? I'm not gonna necessarily glom on to this person's obsession. I might, right? He might talk me into it if I'm in a particularly anxious place and he's like, have you checked your stove? Do you know? Sometimes it can just come on, right? Maybe you scare me into it. But generally, it's not like everything is my obsession. It's a little different for the person with an obsessive compulsive personality disorder. And really, they're not dealing with obsessions. They're kind of dealing with compulsions, but they're not dealing with obsessions in the way that I've described them for this other disorder. What happens for this person, and really what an obsessive compulsive personality is, for lack of a better term, this is somebody who's really anal. This is somebody who likes things just so. For lack of a better term, they're a perfectionist, right? That's not what's going on in the obsessive compulsive disorder. There's nothing perfectionist about not stepping on cracks or washing your clothes over and over again or washing your hands over and over again. There's nothing, I'm not improving anything, right? And I don't even think a person with OCD would delude themselves into thinking, well, my hands are, gonna be they might say they're going to be the cleanest of them all, but they're not any less susceptible to germs as soon as I stop washing them, right? I'm not improving my life by stepping over all these cracks. In fact, it takes me a really long time to get places, right? So even the person with OCD, they're going to notice this. This stuff tends to be pretty dystonic to them. Why can't I just wash my clothes and go up and down the stairs one time or twice to get them in the dryer, instead of 3 or 4 times? I hate that I'm so obsessed with this basket getting dirty, right? They tend to have that kind of negative feeling about their own obsessions. They get tired of them. They realize that they're not very rational. They realize that they're not even really effective in many cases, and yet there's this fear, right? It is driven by that anxiety. They are just driven compulsory, oh my gosh, look it up. They are just driven to do that behavior. I can't help it. I really don't want to go wash my basket again. But geez, it's probably gross. I don't want to die, right? And so they end up going to do those behaviors. That's not a perfectionist behavior, right? That's not what's going on for the obsessive compulsive personality. What's going on for them is they like things just so, right? You walk into this person's house and it's beautifully laid out, right? If that's the thing that they're OCPD about, right? Their house is beautifully laid out, everything is in the perfect place, their dinnerware is perfectly put away, all their cups match, all their plates match, right? Their bed's made every day before they go to work. So this person is just a neat freak and a perfectionist, right? This is the person you go in their house and you move the place setting around a little bit, and what happens? Yep, that exactly, right? They get freaked out. They're saying, "Oh my gosh, you moved this." No, it looks a lot better here. Right? And they may even try to hide the fact that they have this perfectionist aspect, or they may go right at it. Are you an idiot? No, it's gross. It's crooked. You think I'm gonna let a crooked playmat be on my right? They're gonna be this type of person. So that's very different than the obsessive compulsive disorder. When I was first learning about this in undergrad, I had a professor, and obviously this has stuck with me. I asked, what's the difference between OCD and OCPD? The names seem the same. And he says, well, if you need a shortcut, people with obsessive compulsive disorder are annoying to themselves. Again, they have to do these compulsory things. They don't like it. It's frustrating to them. They are super aware of the fact that, hey, I'm in the bathroom for 30 minutes just washing my hands, or hey, I spent an extra 10 minutes getting out of the house because I had to go check the door 5 more times before I could get in my car, right? Whatever it is, they know that. They have this sense of, oh, again, the OCPD person does not have this sense, does not have this sense of being annoying to themselves, right? They are seeking the perfection, and so when they're chasing that just so, when they finally get it, it feels so good. Oh man, that is the straightest place setting anybody's ever seen. If anybody messes it up, we're gonna have a problem, right? It's this kind of thing, right? They like it, they're enjoying it. And so what he said about these folks is, obsessive compulsive disorder, they're annoyed with themselves. OCPD, they're gonna annoy other people. They're gonna be fine with their perfectionism, but it's gonna be more of a problem for people around them trying to exist in a world where they're not perfect, or meet their standards, or show up to their house and not disturb anything too much, right? Imagine having a teacher or somebody who had an obsessive compulsive personality, or I've certainly had students with obsessive compulsive personalities. And one of the things that you see is that, the problem with being a perfectionist like that is often you don't want to let things go. You want to hold on to things until they're perfect. And so that can still cause a lot of problem. But again, they tend to not be worried about that type of thing, unless the timeliness itself is a perfection aspect for them. But if they know, hey, this professor would prefer I take 2 more weeks on the paper, then hand in something that was 90% my best work, if they know they can get that extension, they're going to take the extension and they're going to try to get that as close to what they feel like is 100% as possible. They're not going to be comfortable taking shortcuts. That's the type of thing that's going to be annoying to them, is somebody or something that just feels like it didn't try hard, or it's not as it's not as good as it could be, this type of thing. So very different, right? One's a perfectionist, the OCPD, and the other one is really somebody who's suffering this type of anxiety disorder where things generate anxiety in them and they can't move on until they fix it by doing this thing that doesn't really fix it, right? Washing your hands cleans them up, fine, but you can do that in, my Apple Watch tells me 20 seconds, right? But if you're in there for 5-10 minutes just washing your hands, that's not necessarily any more helpful. And in fact, right, we know that can be hurtful, not necessarily to germs, in terms of germs on your hands, but just in terms of the skin on your hands. So there's that kind of balance of, is the thing you're worried about practical, and is the thing that you're doing over and over again to fix it, is that practical, right? And that's probably the entry point that you're gonna take if you're working with somebody with this obsessive-compulsive disorder. You'll see in the video of the OCD, excuse me, that that the best treatment tends to be some type of cognitive or exposure therapy. That is to say, to just get that person used to standing the anxiety that they're feeling because they stepped on this crack, because they touched something that they thought was a little bit dirty. Okay, well, let's just sit here for 10 minutes, and I know you really want to wash your hands, but let's just see how you feel after 10 minutes, right? Maybe checking in the middle of that 10 minutes. Okay, where's your anxiety at now, right? And what's going to happen is you're going to watch it go up. Oh my God, oh my God, oh my God, you're still not letting me do it. It's digging into my skin, right? They're going to get higher and higher. And then eventually, just like a panic attack, right? Your body cannot sustain that level of anxiety, that level of arousal for too long. Even if psychologically you still would be afraid of it, worried about it, your body is just going to say, all right, the threat does not seem to be hurting us, so we're going to just take a break. And so your body will just calm down. And so you give it some minutes, and then you start saying, okay, how are you feeling? I still would really like to wash my hands, but I feel a little bit better, right? Until you get to the point where the person says, and it may not be in one day, right? This may be over the course of weeks or months, till they say, listen, I'm fine. I won't wash my hands until I get back home, and that's kind of where you want to get them, is where that anxiety doesn't compel them to do the thing. And once the anxiety can't compel you anymore, it will tend to go away, because what's it for if it can't make you run away or run to something? Okay, that was long-winded. So obsessive-compulsive disorder. I'm just going to describe these and maybe tie them into how they're related to the obsessive-compulsive disorder as well. I don't want to go through the symptoms of the disorder itself here. They are pretty long, but you can check these out on page 237 in the DSM, and then wherever they are in your textbook. Okay, so the other types of disorders that we consider to be obsessive-compulsive disorders are pretty different, though you will recognize some of the obsessive and compulsive features of them. So the first is a body dysmorphic disorder. And the body dysmorphic disorder, it used to be, this is one that actually wasn't an anxiety. This was something that I believe was an eating and feeding disorders at the time. But if you think about it, it really is more this thing where you're obsessed with the way your body looks. And so it's not necessarily about eating. It can have those effects on you, but the psychology of it is about some anxiety, about obsessing about how your body looks. And so that is what it is. This is somebody who is looking at their body and they're often obsessed over a part or parts of it or some feature of it. So it might be your hair, right? I'm sure somebody out there has got a body dysmorphic disorder about their balding. I was spared that. I don't really care. But you might be obsessed with the fact that you don't have hair, that you're losing your hair. And so this can take two forms. One is that you actually are losing your hair, and there are some consequences, social consequences likely, that can come with that. And so the dysmorphia will really come in terms of this person over selling or blowing up or being hyperbolic in their head about what that will mean, right? I will never get married. Nobody will ever look at me if I don't have hair on my head. Like, I'm gonna have to spend thousands of dollars to get hair put back before I can even apply for the job I want. Do you think somebody's gonna hire somebody who's bald? That's gross. Everybody hates bald people, right? And so this is kind of a body dysmorphia in terms of really blowing up the results or the outcome or the effect of that thing that maybe is true of you, right? Maybe you have a body dysmorphia about your weight, and you actually are overweight, but you make this mean that all of these terrible things are going to happen to you, and all these wonderful things will never happen to you because you're really putting this one aspect of yourself at the forefront of your whole identity and the forefront of your whole experience in life. And so that's the obsession, right? This person cannot stop thinking about this aspect of their body, what their hair looks like, what their waist looks like, what their face or nose or cheeks or whatever looks like, that they're constantly obsessed with this, and they constantly are basing often their own sense of confidence, their own sense of esteem, their own sense of being effective and helpful and useful in the world on this thing. I'm not thin. Nobody's going to ever X, Y, and Z. I'm not tall. No, everybody's going to think I'm a whatever. And so that's the body dysmorphia in the sense of that. The other one is where the person actually has a dysmorphic, and this is what this word means. The person actually has a dysmorphic view of what their body actually looks like. And so these are folks, for instance, a classic example would be somebody who's really thin, thin by any standard, and yet they see themselves as so fat, right? That's the other type of dysmorphia, where you're not even really seeing the thing clearly anymore, where you've got this obsession over what you think you should look like, and yet you have no real sense of how close or far away or past that goal, that visual goal, if it is, that you are, right? So classically, somebody who's really thin and thinks they need to be thinner, thinks that they're fat, and then subsequently is anorexic or bulimic, right? Again, this used to be in the eating and feeding disorder category because often this does go along with some type of anorexia or bulimia. But again, it really is kind of this different thing. The actual dysmorphia is that psychological obsessive component of I can't stop thinking about X, Y, or Z. I had a client once who was a male client who, there was a lot of stuff going on for this guy, but one of the things in particular was that as he got older, he got hairier, and he's probably actually about my age now, in his late 30s, early 40s, and he started, he probably had hair since his 20s, but he was talking about when he was in his teens and his early 20s and how nice he looked because he had no body hair and he was so smooth, and he, this guy's in the military, actually, so this wasn't kind of a feminine thing. He just didn't necessarily like having body hair, and he thought that now that he was in his 30s, that he had all this body hair, that it was gross, it was disgusting, and that nobody was going to like him, and right, all of these things that we're talking about that often go along with a body dysmorphia. Now, there was some other stuff going on, and so I don't remember if that was the diagnosis that we eventually came to, but you can certainly see some of those features there. You can certainly see the way that he was obsessed with this aspect of himself, and was really basing a lot of how he expected people to receive him, how he expected his future and his outlook to look, based on something relatively small. And then I think I can say that he was blowing up. He had hair on his arms, but nothing that I, even in and out of a professional capacity, that I'd go, oh my God, look, right? It was just something that for him, he was kind of blowing up in his head. That's the dysmorphia. Next, we've got the hoarding disorder, and you guys have probably seen this, if not just seen the kind of television shows that they have about it. This is one of my guilty pleasures. I sometimes sit down and watch hoarders, especially in the morning over coffee. I don't know why, but it warms my heart or something. But the hoarding disorder, right? What you can see there, this is one that's going to be a little bit more of a compulsion side of the obsessive-compulsive disorder. Though, when you talk to these folks, you can definitely hear and begin to see what that obsession underlying that compulsion is. But what we will see of them initially, right, the first thing that we're going to come to is going to be that compulsion, right, the fact that they will not throw things away, or that they keep bringing things in, right, that's the behavior, that's the compulsion that we see. But the obsession is often a little more veiled, and this often requires a little bit of therapy. It's often not on the forefront or on the kind of the tip of their mind, tip of their tongue, the way that the obsessive-compulsive disorder is, right? You sort of know why you're not stepping on the cracks, you know why you're washing your hands for that long. If you ask somebody who's hoarding, why are you keeping all of these things? You know, they'll probably at first just say, well, I like them, or they're nice. Well, why can't you throw them away, right? Well, you know, what's the use in throwing things away, right? In order to get deep into the, I have a fear of loss, or this is my way of demonstrating control, or I feel like if I throw this away, I'm gonna lose a piece of my mother, right? That kind of real obsession piece, that kind of real thing that's compelling the hoarding is often something that you gotta dig into a little bit, right? You gotta say, why are you doing this? Okay, well, why is that important? Well, what will happen if you can't do that anymore? What will happen if you lose these things, right? You gotta start asking those questions to illuminate what it is that they feel like they're holding these things for. And hoarding can look a lot of different ways. It can show up a lot of different ways. It can be the person who is just over consuming. And maybe they take their trash out once a week, and they take out a normal amount of trash once a week, but they're bringing in way more than that every week, right? And so they go to a lot of, I don't know, flea markets or Goodwill, shopping mall, whatever it is, but they're just buying so much stuff, and they're throwing some of it away, but they're definitely not throwing away the stuff that they're buying. Maybe they're intending to give it away as gifts, maybe they're intending to make it into something or use it for something later, right? But they're just bringing in all of this stuff and not as much is going out. And so you see that the hoard begins to build up. Another way might be that this is a person who's bringing in relatively normal amounts of things, but will not throw things away. Right, everything is really important. They save every scrap of paper, every newspaper, every little plastic bag. They save those because you can use those to put your lunch in sometimes, right? They've got old picture albums because, you know, what if the internet blows up and we want to have copies of our pictures? So not only we have old picture albums, but we've actually printed all of the ones that we've taken in the 21st century, right? This type of thing. And so this is the person, right, who's maybe bringing in normal stuff, right, but they can't let things go. They don't maybe throw the trash out even, and sometimes you'll see the hoards look, you know, pretty disgusting, really, because that might also be some of the stuff that they're not letting out. It's just the trash. They're letting the trash pile up. And then I would say there's kind of a third kind of hoarder that's maybe part of the second one, and this is somebody who's just, they're certainly not taking things out, but they're also not throwing things away, or they're throwing things away in places they're not supposed to be thrown away. So, you know, you're finished eating a cup of soup or something, and you just throw the soup can on the ground, or you've, you know, your cat's kitty litter is overflowing, and so you just scoop it into this pile in the corner over here, where you keep the old kitty litter. But, you know, that's a different kind of hoard. And to me, I think probably in the future we might see this disorder split up a couple times, or at least get some identifiers that are going to allow us to think about it in a couple different ways. Because that sort of hoard that's really more of a cleanliness issue, that's really more of a, you know, listen, if somebody came in and would clean it up for me, fine. Like, I don't have any attachment to the kitty litter pile, but I just don't want to do it, or I just can't be bothered, or it doesn't bother me, or this person that I lost used to do that, and so I'm not going to do it. That was their job. So these type of things seem really different than the type of person who's attaching a lot of value to every item. Oh, no, my mom got this at a swap meet once when we were 10. I watched her buy it. I thought it was so cool, and so I just want to keep it. It's a wrapper from, you know, like a 1975 candy bar. I know it's super special. They're rare, right? That's a different person who's keeping that piece of trash for sentimental reasons than the person who just couldn't be bothered to get it to the trash. And hey, do you mind if I pick that candy bar wrapper and throw away for it? Oh, please, thank you. Right, no big deal. And yet their houses, you know, with some difference, look relatively similar in terms of being hoarders. So again, the obsession there is perhaps that piece about the sentimental value, but really what you're going to show up with is the compulsion, often, which is to say the fact that they are keeping or bringing in or not throwing away or not able, as far as they can tell or understand for themselves, throw away other things. Trichotillomania is really different. So this is an obsession. It's more of a compulsion. It's a compulsion to pick your hair. I don't have hair anywhere else. I just got to use my beard. But it's a compulsion to pick your hair, or hair pulling disorder is sometimes what it's called. This is going to be another one of these that's really more of a compulsion. And often there isn't necessarily for this disorder and the next one, there isn't necessarily something in particular. There isn't really an obsession that is behind this compulsion. These last two tend to really just be more compulsive disorders, even more so than the hoarding disorder, where again, you can dig for that obsession. Here, usually the trichotillomania, usually the hair pulling is just a broad anxiety response. And so this person is going to engage in that compulsion, right? Just something they kind of can't help themselves doing or don't notice that they're doing. This person's going to engage in that compulsion when they feel anxious. They're in the middle of a test. They just got some bad news. They're waiting to hear back and see if they got the job, right? All of those things are just kind of anxiety provoking. And you can imagine, I don't have hair, so just imagine, right? You can imagine somebody kind of pulling on their hair to soothe themselves, or maybe kind of yanking them out because they're really tense because they're waiting for this news or freaking out about what's going to happen. So there's nothing necessarily behind that, like, oh, if I don't have hair, I'll be, more appealing. It's nothing like that, right? It's not like these other things where you're kind of taking this obsession and making it into this compulsion because that's how you're going to fix it. This trichotillomania really just is, I'm anxious and this is the thing that kind of makes me feel better. Have you ever pulled your hair because you were just a little anxious? Not diagnosable, but again, just something to help you understand what that might be like, right? How that might relieve some tension for you, or at least feel like it's relieving some tension because you're able to, I don't know if it's the pain or the tension of getting the hair out or whatever it is, but that's what's going on for these folks. What you'll see with them, again, a lot of people will do that a little bit, maybe even just not necessarily pulling their hair out, but just kind of stroking it type of a thing. And that's all relatively normal. Again, things aren't a problem unless they're a problem. So what would that look like? That might look like somebody who was pulling a bald spot in their head, or somebody who was just doing it so much that it was becoming a problem in terms of the actual behavior. They're doing it in the middle of class and they leave the desk and it's covered in hair or something like that, right? That would be the type of thing where we would want it to be a problem, where they're just doing like damage, right? You're maybe starting to get scabs or some other type of skin condition because you're always pulling at your hair. That's when we look at it as a problem, not just because somebody does it to self-soothe once in a while. The other here is excoriation disorder, and it's really just the same as the trichotillomania, except this is a skin-picking disorder. So almost everything I said about trichotillomania will apply here in the excoriation disorder, but this has more to do with skin picking. It sounds gross. I love the word in a gross way. I think it's a cool word, but it is describing something a little, distasteful. But if you want to get a flavor of what that's like, if you want to think, oh my God, when would I ever pick my skin to feel good or to feel less anxious? Think about the last time you picked a scab or popped a pimple, right? And the feeling that you maybe got from that. That's what's going on for these folks, is they're maybe finding some little divot in their skin, something on the side of their fingernail or something, and they're just picking at it because this is sort of an anxious habit, right? They're waiting for that test, they're waiting for that news, and they just start kind of picking at this one point. in their skin. Scab develops a couple days later. Now this is a lot more fun to pick, this scab is, right? They pick that scab off and now they've got a big scab, right? And so there's the problem with it, right? Is of course, just as much as this, if not more, you can start doing real damage to your skin if you're constantly picking at it, pulling the skin off of it. That's not gonna be really healthy. And as the same as with the trichotillomania, again, this isn't something that's going to necessarily have an obsession behind it the way that these others do. This is really going to be more of a broad, anxious response. These last two are really just things people are doing to soothe themselves more than it is to turn off or to counter some type of obsession that they're having. These last two, again, mostly just compulsions.